Hello and welcome. My name is Dr. Alina Ruiz, and I'm the lead nursing faculty for Herzing Orlando. And I wanted to take a moment to talk through an NCLEX style question and show you guys what it's like to break down a high level NCLEX style question. Here we go. Okay. So this kind of question, which of the following clients should the nurse assess first? These kinds of questions are tricky because the word first, as you can see is bolded, means that the nurse has to make a distinction in the care. So these four options, okay, we got to look at them. Client with chronic obstructive pulmonary disease in a tripod position. A client with audible wheezing throughout the lung fields. A client who is a child with stridor and nasal flaring. And D, client with rhonchi. So the first thing we have to figure out is, what is this question asking us? So who do we see first? One of the important nursing actions, prioritization of client care. So all of these clients are going to need to be seen, but in what order? So we have to think about how do we set priorities as nurses? So we have our airway, breathing, and circulation. Okay, those are our priority problems. I like to throw in safety. I call them the ABCs because safety is also important. However, the next way would be Maslow's. So Maslow's hierarchy of needs says that we have to meet our basic human needs like food, water, elimination needs, sex needs. All of those have to come first before we get to actualization, and so on and so forth. So these questions are tricky because all of the options are technically correct. We've got to see them all, right? So the answer here is this one, the client who is a child with stridor and nasal flaring. This question is trying to figure out if you know that stridor is a medical emergency. That means that the client's airways are starting to close off. Okay? If we don't intervene, okay, we got to take this all the way through our Kaplan decision tree, or how we would go about answering this question. The algorithm would be, what is the outcome of our options? So if we don't intervene for a child with stridor and nasal flaring, this is a medical emergency. This client could have some pretty negative outcomes. Okay? So we would go child with stridor, then maybe the patient who's wheezing, because that's going to need an immediate reaction. If we don't intervene, the wheezing is going to turn worse. Okay? And then the next one would be the patient in the tripod position, because patient in the tripod position, that's also struggling to breathe, but maybe not to the level of these other clients. And then the last one would be rhonchi, which is just a little bit of congestion. So hope that was helpful, and hope you guys have a wonderful day.